Good morning, everyone. I hope you're well. We're going to make a start. We're expecting a few more people, but I don't want to keep you hanging on the line for much longer. So it's very nice to see you all. I know it's afternoon for some of you, and thank you very much for joining us. You will see the name Catherine Kenyon on the login details. We've actually borrowed the webinar from ActionAid. And so my name is Samantha Wakefield. I'm from the CHS Alliance. And I'm joined by Balint in London, who's sitting with me. And Balint is our communications officer. Justine is also online, and she's the consultant who's been working with us on the guidelines. I won't ask you all to introduce yourselves, because that would take quite a long time. But what I am going to do is I'm going to unmute you all, because there's quite a lot of background noise. So if any of you want to speak, would you mind typing a message in the chat box to us? Hopefully you know how to do that. But you will find the chat function on screen. And so if you have a question or a comment or anything to add, then please just send a chat message and then we'll unmute you. Okay? So we'll mute all. So just to start off, this is the first webinar that we've run on HR good practice. And some of you may know that the CHS Alliance has been the technical advisor on the Transforming Surge Capacity project run by the START network. The project is coming to an end at the end of this year. So we just thought it was a good time to share some of the work that's been done over the last year on HR good practice. Justine has been working with us as the consultant and has pulled together 3 sets of guidelines and is working on another 3 sets of guidelines around HR good practice when it comes to surge and humanitarian response. A lot of the work that we've done you will know already, but we found it quite difficult to find documents and guidelines that supported some of the issues. So we thought it would be a good idea to talk to a few agencies and put together the guidelines, and then it gives everyone a starting point. So although they're there for you to adapt, they're a starting point, so you don't have to start things from a blank piece of paper. Can I just check that everyone can hear me okay, and I'm speaking clearly and the volume is okay? Great, thanks everyone. Okay, so what we're going to do is the webinar will be about 45 minutes. I'm going to give you some background to the project. Then I'm going to go through each guideline with a quick summary, what we did, how the guidelines evolved, ask you some questions, have a bit of a discussion to see if you've got any further input. So I'd say about 45 minutes, but we'll see how many questions you've got and how the discussion goes. I haven't put myself on video because we're going to take you through the presentation instead. And sometimes it's a bit easier to focus on a presentation whilst you're online. So I hope that's okay. I've met some of you, but not all of you in the past. But we can use the video another time. So just to give you some background to the Transforming Surge project, as I mentioned, the CHS Alliance is a technical partner in the Transforming Surge Capacity project. And Justine has been the HR consultant working on this project. The START network, as you probably most of you know, is a consortium of NGOs, and there's a number of different projects. The CHS Alliance has been involved in talent development and transforming surge capacity in particular, although there are many other projects such as Shifting Power, which you'd be very familiar with. And these projects have been running for 3 years and run until the end of the year. The background to this project, Transforming Surge Capacity, is it's around strengthening national and regional surge systems to work better with international systems, to help organisations move from focusing on individual surge capacity to working with others to build everyone's capacity, and to bring stakeholders like the UN, private sector and universities on board to explore how they can help. In particular, HR Good Practice has been looking at identifying, developing and sharing HR good practice, and this was seen as a cross-cutting theme. So it's great that HR was identified at the early stages of the project and brought in at the beginning and acknowledged as a cross-cutting theme. So the work that's been done to date is the development of an online interactive HR website. If you're not a member, then we can send you details after the webinar. Justine has set that up, and it contains new and interesting resources on HR good practice when it comes to surge and humanitarian response. There's an online forum on there as well, so if you have any questions or comments, then please add anything. The website's open to any professional in the sector, so have a look and send us an email if you want to join, and if you haven't joined already, when we can put you onto the group straight away. Justine also runs a cross-country HR working group that feeds into some of the work. So all the work that she's done hasn't been done in isolation, it's been through the HR working group, which is spread over a number of countries that have been involved in the project. So Pakistan, the Philippines, at regional level, Plan at the regional level in Bangkok have been involved as well. We've also had 2 HR good practice conferences. One was in Bangkok and one was in London at the start of the year, which discussed current issues when it comes to HR's role in transforming surge. And we've been collecting and sharing new guidelines, good practice documents and case studies. So in summary, that's some of the work that we've been focusing on. In particular, if you haven't looked at it already, it might be worth, and we'll add it to this presentation so that you can click the link, but it might be worth you looking at the report that was done called Time to Move On. And this was done as part of the START Network project, and it was looking at the national perspective on transforming surge capacity. So many of the issues that we addressed as the HR group came out of the Time to Move On report. And this looked at the impact, it particularly looked at localization, but the impact that international NGOs can have on national NGOs at the start of surge. And we'll come on to that in a minute. So the reason why we organised the webinar was just to make more people aware of the work, because we're very aware that a lot of the START Network organisations are aware of the work that's going on, but beyond that, as an HR community, you might not be so aware. You're all invited to add to the work. If you have case studies to share or anything that you've done that's on a similar theme, then please let us know. We'll hope you'll use some of the guidelines. And we're also very keen to talk to people to develop some case studies on the 3 areas that we're going to talk about today. So I just wondered if you had any questions before I start to go through the guidelines. No, well, okay. I'm relying on you to type rather than talk. No, okay. So the new HR guidelines that have been developed as part of the project have been around HR coordination in surge, HR's role in staff care, and ethical recruitment. We've also got 3 other topics that we're working on, and I'll tell you about those at the end, but those were the areas that were identified at the HR conference in London as to be key areas for us to look at. So the webinar will share the first 3 of these guidelines, and these are the areas that we thought were key when you're looking at surge capacity. So Balance sent out the links to the documents in the invitation email, but we'll resend the links again so you can find them, but they're all on our website under the Start Network page that we have, but don't worry, we'll send you the link. So the first one was around HR coordination, and the guideline provides a starting point based on learning for HR coordination at the start of a response. And when we started to talk to people, we found that there was very little actually written down on HR coordination. In some responses, it just happens automatically. In others, it doesn't happen until a few months down the line. So we thought it might be useful to write some guidelines and produce a template for terms of reference. So there's a starting point there for the start of a response, and then you don't have to start from scratch. So when Justine talked to a few organisations, she used a case study from the Nepal earthquake response in 2015. And basically, from the discussions that she had, it seemed to be that there was a very informal network in Nepal amongst HR staff. But I mean, as we all know, when a response escalates, new people are brought in, there's a lot of changes in personnel, and there's no established forum. And what the HR staff in Nepal felt was that it would have been invaluable during the first few weeks of the response to have that network or that forum set up from the very beginning. And we all know that that makes sense, but we also all know that the workload is so high that nobody's got time to think about anything externally because everyone's focused on the internal setup. So just as there's a cluster system amongst different sectors, amongst different technical specialisms in our sector, we don't actually have an HR cluster as such. And so the recommendation is to set up an HR coordination forum or coordination group at the beginning, and to use that to share legal information or information about suppliers or recruitment practices, or just even different ways of attracting staff, cultural issues, benchmarking, and so on. And we do have a culture of sharing in our sector. So it's, although we sometimes are competing for different types of staff, we also do have a culture of sharing at the same time. So that was the key recommendation. What the group from Nepal recommended and what they did after a couple of months was they did formalise their HR coordination group. They identified a coordinator. This was rotated every 6 months. A terms of reference was established. They actually registered themselves as a formal coordination group, the Association of INGOs in Nepal. And one of the key issues, which I think on reflection members of the group thought, was that they hadn't invited the national NGOs to the forum. There was to be a move to invite them to the forum later, but with the whole push to localization, I think there was acknowledgement that they should have been invited earlier and at the very beginning. So the feedback from the HR staff in Nepal was that the key benefits have been around learning and sharing with each other, sharing documents, best practice, benchmarking, sharing training between agencies, and so on. I think we all know the benefits. I think it was just to set down what to think about when it's busy and when you need to set up a coordination group quickly. So you will see in the guidelines an example of a TOR. Obviously, that is there for use and adaptation. It won't suit every situation, but it gives you a template to work from. We didn't find anything that was written down from the people that we talked to. So one HR professional who'd been working in response for a number of years drafted that for us based on their experience. if you have ever come across the terms of reference, or if you have any experience of setting up an HR coordination group, then let us know, and we can add more examples or more case studies. So I think there's another slide, sorry. The key recommendations from this work was to establish the group as quickly as possible, despite being super busy, include both national and international organisations, and start with the TOR to make the HR coordination group as effective as quickly as possible. So I've talked quite a lot there, and I just wondered if anyone had any comments, any experience of this, anything to share with the group, or any questions. I'm going to unmute you all. Anything to add? Does it make sense? Yes? Does it make sense?
Yes.
Thank you. Have the UN agencies been engaged in this? No, not yet. No, we haven't engaged with them yet. That's something we could think about going forward. This is just focused on INGOs to start with. Have you got any suggestions on who we should start with engaging on? Okay, thanks, Claire. I've unmuted you all so you can speak. Thanks, Claire. Any other comments, questions? If not, we'll move on. Okay, I'm going to mute you all for the time being. So our second guideline was around HR's role in staff care. And this guideline provides advice to HR staff on how they can ensure staff care is an integral part of surge response. We've got a lot of resources in this guideline. I think what's different about this guideline is that it sets out the expectations and the different roles and responsibilities for staff care at the start of a response. I suspect it's something, again, that we all do, but we might not have documented that in some of our policies, procedures and guidelines. So we just did a summary of where we thought HR's role could be in supporting staff care. I think this document could also help identify different areas for job descriptions and when setting up systems as well. So as I said, there's probably nothing new in there, but it just might give a few pointers when you're thinking about designing jobs, or you're thinking about setting up things at the start, systems at the start of search. So just to go through the key points, what we thought, and when Justine spoke to people about HR's role in staff care, we know that many people have developed welfare and wellbeing policies and practices, and ACF, as part of the START network, has done a lot of work on wellbeing and produced some excellent resources. I'm not sure they're still online yet, but we'll make some inquiries. So there is a resource pack which will identify where you can get external support from. So we'll find out if that's been published and put that in the pack. And the other document that we referred to in this guideline are the Essentials of Staff Care. This was written by the Contera group, and it's a nice summary of presentation of all the elements that you should be thinking of. And again, we'll make sure that you've got the link so that you can refer to that. So in terms of HR's role in staff care, we thought that HR's role should be around influencing senior management team and partnering with the relevant functions. So we thought that HR is often the ones that end up influencing the leadership team to make commitment around staff care. There are some brilliant leaders that will think about it before HR talks to them, but at the same time, we know as HR professionals, we're the ones that will be taking the issue to the leadership team, probably. But we're also the champions for ensuring that staff care is integral to how a staff member is recruited, which means talking a lot to line managers as well as leadership. We also know that the key to a lot of this is HR providing support to managers on a day-to-day basis on how they manage their staff. We also thought that HR has a role to play in partnering with other functions, and the crossover functions that we identified was security. Often security advisors are great on staff care or duty of care, and it can be really useful to work alongside them. Health and safety, the travel team, if you have a travel team or whoever does the travel bookings, we know that you have to work alongside them too, and office management. So just ensuring that they're also considering staff care in all aspects of work. We also thought that HR had a role in coaching and supporting line managers, because as we know, most of it is day-to-day, and we know that the line managers are closest to staff and will identify issues as they arise. So as well as influencing an organisational commitment, we obviously thought HR had a role in recruitment and selection, and so thought that staff care and questions on resilience and stress could be included at interview. It could also be included at the reference check stage. And there are some good examples in the sector where there's been a psychological assessment as part of the selection process where an assignment has deemed it. So I've previously worked on search and rescue where the deployment is very intense for a short period of time, and anyone on that would be working on that project would have to go through a psychological assessment before they could be deployed, and there would be follow-up as part of that process as well. So just moving on. Obviously there's a role in induction and preparing staff. So the briefings, any induction should include a briefing on staff care and wellbeing, and the individuals should know how to access support, whether that's internal or external. But also training is an important element, and there's a lot of resources. I know it's not always ideal to do training online, but it's also a supplementary resource. There's a lot of resources online for training. But also briefing notes and checklists should be available to staff as well, so they know where to access support. Also for HR, I don't know if you've ever been involved in critical incident training, where there's often a member of staff identified to provide the critical incident support. This often gets referred to HR, but I think it's very much looking at the type of people you have in HR and whether they can provide that sort of support. And this can be quite separate from security training. So a lot of this is sort of, everyone thinks once you've done security management training, then it's covered, but there probably is more that could be done around personal resilience and managing stress directly. And then support during employment. There's the whole remit of the whole area of setting up external support, psychological support services, but the areas around critical incident reporting, critical incident management, regular reporting on absences related to stress. So setting up those systems to monitor what's going on in the organisation, but also to be prepared for when something happens. So if something happens, you're not scrambling around trying to find external providers for support. It might be worth also asking HR staff to go through coaching and mentoring and basic counselling training, which doesn't replace external psychological support, but is a backup to support some staff and point them in the right direction. I think during the security training, when there is critical incidents, the roles of HR need to be identified clearly if there's to be an evacuation or if an incident occurs as to who would do what, and ensuring everyone's got the right information, that a family liaison person is also identified and trained, but also that reviews of critical incidents take place once they've happened, so that systems can be improved as you move along. And also, I don't know if you include questions in your staff survey around staff well-being, but many issues can be raised at that point, and that's great information for improvement. And then lastly, after assignment, and to make sure that questions around staff care are included in the exit interview. Again, that provides great information for making changes where you need to. I think one of the things that's emphasised in this guideline is that everything has to be relevant to the culture of the country you're operating in. So where one method of providing staff support, I don't know, counselling, is great in one country, it might not be appropriate in another country. And so we do emphasise that it has to be tailored to the needs of, or the culture of the country that you're working in. So this guideline has 4 appendices. We've included some example interview questions that you might want to ask candidates around stress, resilience and staff care. We've included some example reference checking questions, some questions for a staff survey, and some example exit questions. And we will also make sure that you get the links for the resources that I've talked about, so Contara and the work that ACF has been doing around pulling resources on wellbeing. I'm going to unmute you all and ask if you've got any questions or anything to add on that.
I have a question or perhaps a comment. Can you hear me okay?
Yeah, very well, thank you.
Great. I was wondering if you had any findings or went into it at all about HR's role in terms of advocate or helping in terms of accountability when it comes to things such as sexual harassment or organizational corruption, kind of the more internal organizational sources of stress, I suppose.
Yeah, that's interesting. We haven't done any work on that, but that's an interesting point. I'm just writing that down. I don't know if anyone has done any work on that. I've not seen anything. So let me have a look to see if I can find that. We certainly haven't done anything as part of this project. Have you come across anything? No.
Not that I know of.
No. We'll have a look and get back to you if we can find anything. Yeah, we didn't address that as part of this project, but it is an interesting point. Yeah.
Okay, great, thank you.
Thank you, thanks.
Yeah, we have with our organization, we have a normal complaints mechanism and as well an online...
Sorry, I can't hear you. Can you get closer to the microphone?
Okay, can you hear me now?
Yes, that's better.
Sorry. And not only in responses, but in a general way, in our child protection policy, we have a complaints mechanism if we say any sexual harassment or any let's say behavior, we have to do report, and there's a confidential online. We have established a confidential online system that we can get that to our senior management. So maybe other organizations have the same or should establish something, even in responses or normally when you work in the field with children in the community, there shall be such system in place. Maybe that may help, or is it what you have asked?
Okay, so from what I understood, you said that in your organisation you have a complaints mechanism as part of child protection or part of issues around code of conduct. and you have a confidential reporting process where people report online. We haven't addressed that in HR's role in staff care. To be honest, we could actually add something around confidentiality and how staff can get support within an organisation for HR to consider that. But we didn't address the issues around code of conduct in the staff care guidelines as such. People in aid did have some guidelines on the code of conduct and what to include in that. I don't know if it has anything about a confidential reporting system. I'm sure it does. Look at that, but we could also consider that as part of the guidelines. So thank you for that.
So are the guidelines still being edited? They're in draft form then, or?
No, they've been published. They're online, but it's for us to add if we want to. You know, they're our documents, so they're live documents.
Sure.
What we're hoping for is to add some case studies. I'll come on to that at the end. So we're sort of building on them, and if people, you know, if there are glaring gaps, and if people have anything should be added, then we can do that. They're live documents. That's the good thing about having things online and not printing. Okay, I'm going to move on to the third document, and I'm going to mute you all again. So type if you want to say anything. What does that mean, Alex? You have logged in front of it. Should I just press OK? Yeah. Okay. Oh, I don't know what that is. Anyway, sorry, I'm not very technical. Right. I've just clicked it off. Yeah. It'll be all right. Okay, sorry about that. Okay, ethical recruitment. Now, this was prompted by the research and the document that I mentioned, Time to Move On, National Perspectives on Transforming Surge Capacity. If you haven't read it, I definitely recommend it, and we will send you the link. It's on our website. It's on the Start Network's website. It's very interesting reading. So the issues, the guideline considers the issues to be taken into account when recruiting for surge response and considering the impact, the negative impact it can have on other organisations. So what makes this guideline a bit different to other HR guidelines you might have seen on recruitment is it addresses some of the issues that national NGOs face at the start of surge and directly aims to protect national NGOs' capacity. And we all know it's never going to be perfect, but if there are some key principles agreed, then that would go some way to supporting national NGOs as well as INGO response. So Andy Featherstone's report, the Time to Move On report, talked about the practice of international NGOs when recruiting national staff and how they can undermine national NGO capacity. So what his recommendations were around surge planning being at the heart of surge planning having been, what am I trying to say? Surge planning considering the impact this can have on national NGOs. So what we've put together in the guidelines were just some principles for organisations to consider when they're doing their surge planning. So a lot of this was around respecting the notice periods of other organisations. So in Andy's research, he found that there was pressure on national staff if they came from a partner or a national organisation to leave their position immediately. And I think the call for action was around INGOs respecting notice periods of other organisations, or at least negotiating and discussing with other organisations realistic release dates. I think there was also a recommendation around not poaching and to have open and transparent recruitment practices. So in the guidelines that Justine put together, you would just see some pointers around some of the principles around recruitment, which we all know. But but it's around widening your recruitment pool, not just relying on word of mouth, being transparent around decisions, just not relying on one method of selection, making sure there's clearance checking for any new members of staff, so with references. I think in Andy's report, if I remember rightly, there was a practice of references just not being checked and people just moving straight into INGOs. But also being mindful of legal requirements and the obligations of INGOs. And we know some of the countries that we work in, we are required to involve certain government bodies during interviews. It's not the same everywhere, but we know that there are some obligations that we need to fulfill. And the key area was around avoiding poaching from other organisations and supporting national organisations to fill gaps. And so we all know that national staff in national organisations may well be keen to apply to INGOs for different positions, but the emphasis is on international NGOs' role in poaching staff, approaching them, asking them to apply for jobs, and to avoid that. But also to consider alternative ways of filling gaps. There's a common arrangement, so then at least if somebody moves to an organisation for a period of time to an INGO, they go back to the national NGO with different type of experience and new skills. But also offering to support capacity building of remaining staff in the national organisation if that's what they want, if that's where the gaps are. And also working alongside the national organisation. So if there is a gap and you do have some CVs that you can pass, to sort of just keep that discussion and that dialogue going. So what we have to share in the guidelines are Cathodes' principles around ethical recruitment, which they developed as a result of Andy Phillistone's paper, and really it lists the areas I've just talked about. So they will openly advertise vacancies, never directly approach an individual, attempt to first deploy their own staff and then go to open recruitment after that. And then they talk about advertising roles openly, transparently, doing interviews and taking references, offering salaries that are benchmarked to local salaries and respecting notice periods. So if you haven't read it already, it's worth looking at Cathodes' ethical recruitment statement. And again, that's something that you might want to adapt for your own use. So I think some of those recommendations are quite straightforward and things that we believe in, but sometimes, as we know at the start of a response, when everyone's trying to fill vacancies, there can be a lot of pressure on recruitment. And so maybe identifying some of these principles beforehand may support national organisations at the same time. So that was a very quick run through on ethical recruitment, and I'm going to unmute you to ask for any questions. Any questions? Anyone come across this? Anyone have their own guidelines?
Hi, Sam, it's Claire here. Can you hear me?
Yeah, loud and clear.
Hi, hello.
Hello.
I remember reading something in Andy Featherstone's report about some kind of recommendation about compensation for, is that included in these guidelines, or is that something that isn't?
Yeah, we discussed this a bit at the HR conference in January, and it's a very interesting point. I think Cathodes thought, I don't know if anyone from Cathodes is on the line, but I think what they think is that they'd rather avoid the situation where a compensation payment is made. So for everyone else, in the report, it does talk about the possibility of an INGO paying a national organisation compensation for a member of staff moving to their organisation. I think Cathodes' view, and when we talked at the HR conference, was that we would rather avoid getting into the situation of having to pay compensation. It can also get very complicated with funds and what donors would think if we were doing that. And as an ethical point of view, we'd rather avoid getting into that situation where we need to pay compensation. And it doesn't really help the capacity of national organisations. And that's not to say an organisation, they still might want to do that, but we didn't include that in this guideline.
Okay, that's fine. I actually agree with you, and I couldn't figure out in practice how it would work. So yeah, I can see what you're saying. Thank you.
Okay, so we've got a question. Sorry, I don't know your first name. You said, oh, Marina. Hiya. To what extent were national government agencies and local government units, who are supposed to be at the front line of the response, affected by moving their agencies to INGOs that are offering better compensation? Yes, I think if you have a look at Andy's report, and I'll send you the link later, he was saying very similar things. He talked about, I think it was one national organisation that lost 9 staff to an INGO because they were offering better compensation practices. And I know we're still going to get that in some responses. That is going to happen, but I think if there are identified principles beforehand, where managers are engaged in those principles, at least we can eliminate some of that that situation. Any more questions or comments from anyone? No. Okay, well, we're coming to the end of the webinar. What I would like to ask you all is if you do have any case studies of where you have worked with on ethical recruitment or HR's role in staff care, or any examples of where you've changed practice and it's been effective, please let us know and please share with us, because we're trying to pull together some case studies on each of these areas. So if you do have anything to share, then we can talk to them and profile some of the great work that you've done already. So we've been in touch with Cathodes on the ethical recruitment, but there might be other agencies out there that might have some other principles that are very similar, and we'd be very keen to profile those or share those across the HR community as well. So please get in touch with us. And then just to end, just so you know what's coming next, and if you thought this was a useful webinar, we can organise a similar one once the guidelines are finished. We will be looking at monitoring the impact of HR, and so that's around looking at well, our return on investment as HR in the start of a response. We're also looking at safer recruitment. And so this is around the types of checks that you should be doing at the start of a response to ensure that we're not employing the wrong people. But also, as we've just discussed, national NGO capacity and looking at what HR can do to support that. Given that a lot of national NGOs, quite a lot, do have HR support, quite a few don't. And so how, as partners, can we support national NGOs? So please, if you have anything to contribute to those 3 areas, do get in touch with us as well. It would be also good to hear your feedback on the webinars. This is the first time we've done one. If you think this is interesting and a good idea, it's something that we can continue to do and maybe just keep picking topics every few weeks, every 6 weeks or every 2 months. And just organise a webinar for a discussion on different areas. We'll definitely organise a webinar on these 3 guidelines, but if it's something you'd like the CHS Alliance to continue doing, then let us know. And we will make sure this presentation with all of the links is on the website, and so we'll send out a message to you all, and you can find it there. But please stay in touch with us and thoughts and ideas. Next week we have a webinar on Project Fair, so just quick promotion on that. It's next Wednesday, 9 o'clock UK time. Project Fair was a project we were involved in looking at the disparity between international and national staff salaries. We had a workshop in London to discuss the results, and you're all welcome to participate in the webinar next week at the same time, and that'll be run by Ishbel from the University of Edinburgh to discuss some of the findings So you're very welcome. So that just leaves me to say a very big thank you. And if anyone has anything to add, then please do. No? Okay. Thank you, everyone. And please stay in touch. Bye-bye.
Bye.
Thank you. Bye.
Thank you.
Bye. Oh, right. Which one?
How do I